All right, we are back with another great episode, and I am excited to introduce our next guest. I am here with Dr. Larry Burks. So he is another fellow chiropractor, but he has a whole different specialty compared to what we do. He's the owner of the Upper Cervical Clinic, and I look forward to asking him questions about his technique and how he does things. And so Dr. Larry Burks got his education at Oregon State. That's what kickstarted the, whole pre-med. He got his degree in exercise and sports science and then pursued his doctorate at Life down in California.
Mm-hmm.
And then he furthered his education in what is called knee, chest, upper cervical specific technique.
Yes, very good.
And he can talk a lot more about that, but our paths have crossed in different ways. That's one reason or one way we know each other. Well, his clinic's just not even maybe a mile down the street.
30 seconds.
Yes. Our kids dance at the same place, Fired Up here in Tigard. And then our kids attended the same school at Gardy Christian. We go to the same church at AT. So our paths, this was going to happen one way or another. So, I'm very excited to have Dr. Larry Burks on the podcast. So welcome to the podcast.
Hey, thanks for doing these. I mean, it's such a big help for the community where you're bringing in other professionals and kind of, spreading some information about what's available, even if it's not here.
Right.
And that speaks volumes to your, character and how you're trying to help the community, even if it's not just physically in this office. So
right. Yeah.
That's good.
That was one big reason was to educate our community, to provide information.
Yeah.
I mean, I love podcasts. I listen to them all the time, and almost everybody I talk to like, oh, daily I listen to podcasts. I'm like,
okay,
all right, I'm going to start one for this area, this community.
Yes.
And be a value to our patients or people in the area that maybe aren't patients. So
sure.
And I've always been curious about upper cervical chiropractic.
Okay.
I heard about it in school.
Yeah.
I shadowed a few doctors that did like Blair and Nuka.
Yeah.
And so I'm excited to learn more about, your specific technique. But can you, give an overview of how you got into chiropractic and then also how you got into upper cervical technique? What drew you in?
Yeah. So in high school, everyone's asking, oh, what kind of job are you going to get? And I always thought healthcare was my route.
Okay.
I liked helping people, but for some reason, helping them with their health was kind of my passion, I guess. And so I thought, okay, there's different avenues here. One of them is going to deal with blood and guts and gross things. And I was like, I don't want to do that. So let's stay outside the body. And I thought physical therapy would be a really good option.
Yeah.
So went to college undergrad for that and graduated, had all the prereqs to go there, and got married right after college. And we moved and I got a new job as a chiropractic assistant.
Oh, really? Okay.
And I've never had any chiropractic before then.
Oh, wow.
There was a physical therapist that adjusted my neck once, and I thought, whoa, that was crazy. But I got hired as a CA and for 3 different doctors, fairly local to here.
Okay.
And was just working and getting ready to apply to be into physical therapy school or even physician assistant. I was thinking about. And at that time, they only took classes once a year.
Okay.
And at the time when I wanted to get in, it had just closed the door for accepting applications. So I'm like, I gotta wait a whole nother year.
Yeah.
I need to get my career going here.
Yeah.
And all the doctors are like, why don't you just be a chiropractor? I'm like, I guess maybe.
Yeah.
And then they all decided, or they told me to, just apply to this one school down here on the West Coast. And they all had 3 come from different chiropractic schools.
That was a clinic here in town.
Yeah, in Hillsdale.
Oh, okay.
And so I just applied there and said, we're just sticking on the West Coast here.
Okay.
My wife and I packed up, and then 4 years later we came back and opened up shop.
Wow.
I didn't plan on doing upper cervical, or I didn't even know what it was.
Okay.
Until maybe midway through school.
Yeah.
And we got to the part where we got your adjusting partners, right? You're going to start working on someone and they're going to work on you.
Yeah.
And you're going to be observed and hopefully you don't hurt each other.
Yeah.
Right. Well, they start in, I think maybe like mid back area, you know, because that's pretty safe, pretty calm. And everyone's
that's
like,
where we started too.
You know, just give me the basics. And then we get up to the neck and I just started not freaking out outwardly, but inside I'm like, man, this is feeling kind of complicated, a lot more going on. And then as we go through the anatomy courses and things like that, I started realizing, wow, this is a whole different animal, especially at the top of the neck.
Yeah.
Where you have your atlas and axis, of course.
Yeah.
And then the biggest thing was I wasn't knowing or confident of when I thought a patient actually needed an adjustment.
Okay.
They could feel a few things, but of course, being a student, palpation wasn't developed perfectly or even much.
Oh, I thought my professors were making stuff up.
Yeah,
I'm like, you can't feel that.
Right. Yeah, it's right there.
Yeah.
Like, okay. And so I said, there's got to be some sort of diagnostic or something that I can really jump into and go hard at to know when I should do something and when I should leave it alone.
Right.
And so that for me was infrared thermography.
Oh, okay.
And what that is using a measurement of heat from the body,
right,
looking at blood flow as the brainstem and nervous system control blood vessel diameter, and relating that to how an alignment is at the very top of the neck because it's up here.
Right.
Yeah, if your brainstem was in your low back, I'd be the low back clinic.
Yeah.
So anyway, the thermography, I was like, oh, wow, you can see when they're in good alignment and when they're not, and fairly black and white.
Right.
And then I was like, okay, well, what technique or how do I correct this? Well, how do I actually, use it? And that was upper cervical used.
Yeah.
And so I was looking into that, and this whole world of upper cervical chiropractic kind of came into the forefront
because they kind of open up this world of chiropractic to you in school.
Yeah.
And hey, there's this, there's that.
The school I went
to
had like 13 techniques.
Right.
I think at the time.
Yeah.
And there are some basic ones that they taught, multiple quarters, and then some were like just one class.
Yeah.
Here's
introduction
a flavor,
to it.
Taste. And one of those, just one single class was a knee chest upper cervical, but they also had all these other about 5 different upper cervical techniques.
Right.
So anyway, I was just intrigued with using thermography and some, it felt like to me more objective data to really, for my, peace of mind, like I need to help them or don't touch them right now.
Right.
And just kind of got into that world and realized at my school there was some training, but I needed to get more. So I would do weekend courses almost all the time. Yeah. So paralleling the really hard work of chiropractic doctorate degree,
a lot.
And then upper cervical technique and understanding side by side. Yeah. So then when I graduated, we opened up just an upper cervical clinic.
Okay.
And went from that point, 12 years later, here we are.
That's awesome. So, I mean, you've been right here in the Tigard, Beaverton, Lake Oswego area.
Yeah.
Definitely. The whole time.
We didn't buy another practice and then transition into upper cervical from scratch, which is harder. Especially an unknown kind of style of care. Yeah. But it's been going well and definitely not smooth sailing all the time, but as any business kind of starts up. But anyway, so it wasn't like a life experience or some sort of injury that I had and I was introduced that way. It was just, I guess my path was kind of laid out before me and I didn't know, but I was kind of guided, check things out and this feels right. So that's kind of how I landed on that.
That's awesome.
The technique itself, knee, chest, upper cervical, is kind of the grandfather of what many upper cervical docs do today. So we've got the knee chest one, then we've got toggle recoil, which is a side posture adjustment. I do both of those in my clinic. So I kind of have two. And then the most popular one is NUCA. That's the acronym.
And that's National, with the instrument.
Not the NUCA one.
No.
I'll get there. Yeah. Okay. So NUCA is done by hand. It's more of like a press and hold technique.
Right. Okay.
Very lightweight. And it's a little bit hard on the practitioner because you're always been over for a long time. And so there's pros and cons with the techniques for the practitioner themselves. To apply and to keep things going. We got Blair. That's a name of a doctor that developed his own kind of technique.
Okay.
It's a side posture one, similar to toggle recoil.
Okay.
But NUCA is what most people think of when they hear Atlas care or upper cervical care,
Right.
because that's the most practiced and widely trained.
Okay.
So, so what I like to say, is I do upper cervical care.
Mm-hmm.
If someone needs a specific technique, then I've got people that I can refer to.
Yeah.
If they just know that their Atlas or Axis is not right, then I can help them.
Okay.
So, but yeah, it was just kind of a journey of understanding what's out there and then kind of honing into what thermography I felt I could clear those scans with the best.
Yeah.
And I do like to use my hands, not necessarily instruments.
Okay.
Sometimes I do.
Okay.
But by hand, I mean, it's even in the word chiropractic, chiro, right?
Yeah.
So you just have this connection with a patient where you can feel when they're ready.
Okay.
Or, whoa, they're bracing, hands off. There's a little disconnect sometimes, in my opinion, when an instrument is used.
Yeah. For sure.
But I mean, sometimes I'm going off on all sorts of
No, it's great. It's good.
Sometimes we customize the adjustment.
Okay.
So, knee chest or toggle recoil is like the technique basis. But sometimes someone needs that posture, maybe with a lighter adjustment force, because they're super neurologically sensitive.
Okay. Or
you can do just one impulse, and that will be close to the line of making them feel, whoa, that was too much stimulation to the brain. Post-concussion patients maybe, or someone that has hypermobility in the neck.
Yeah.
You don't want to do something too big and move too much. So anyway, those are what I do with technique wise.
That's awesome.
So, yeah.
So if a patient, comes new patient to you, you do just kind of visualize it for people. You do a scan to the back of their neck.
Yeah. So
that will show.
Yes. We do 4 thermography scans in the exam.
Okay.
First visit.
Okay.
We're looking for a baseline of that pathological pattern. And to see kind of what that foundational look is.
Okay.
And we use that at checkups as they go through their care. If they look like what they did when they show up, they need an adjustment.
Yeah.
If it's clear, a nice straight line or something adaptive, something different, we consider not touching it.
Okay.
So some patients come in and they don't actually get an adjustment on a visit.
Yeah.
Which is kind of strange for some people who've had chiropractic care.
Yeah.
And it's just we're looking at it a little different angle. And for me, that's kind of a high 5 visit, even though it's short and they didn't get an adjustment. We're like, great, you're holding. That's where upper cervical comes in, is holding is healing, kind of the mantra there. So if you hold your alignment, you're getting all those nerve signals up and down, of course. And the longer you hold that, the better function improves, the dysfunction fades away, and you start to see the shift of feeling better longer and less of these flare-ups.
That's awesome. So, and it correlates a lot. Like if they say I have these right-sided headaches, the scan often, I'm seeing
it doesn't actually. So there's not a correlation with that. There are, 30 plus year doctors out there that have seen some trends in their practice. I can't think of specific ones that they would mention. But the scan itself won't trend to say, I see. You need adjustment on the right because we see a big flare that way. As far as thermography goes.
Got it. But just more of a sign of the dysfunction.
Yes. What is their thumbprint unique look when they're out of alignment?
I see.
It doesn't change unless they have a new injury, or there's misalignment that could create a new pattern. So it's kind of like we get that foundational look on the exam.
I see.
And then at every visit, we scan them to see if they are in pattern, meaning they need an adjustment. And after they get their adjustment, and then they rest for 15 minutes, and then I scan them before they leave.
I see.
So pre and post adjustment.
That's cool.
Scans.
That's awesome.
So other techniques in upper cervical will use leg length analysis checks before and after. Postural analysis, if someone's compensating. And other neurological tests. But for knee, chest, upper cervical, that specific, or toggle recoil, the thermography is kind of the gold standard.
Got it.
And then, and
x-rays too, right?
Yes. So I'm not touching anyone's neck unless I see x-rays.
Okay. All right.
So we do them in-house like you guys.
Yeah.
We get our 3 views. So we're trying to find exactly how things are misaligned under that foramen magnum, the big hole in your skull, where the brainstem pokes down a little bit.
Super important area.
That's our orientation.
Okay.
Other techniques are going to be trying to, other upper cervical techniques, align that atlas to more of an orthogonal process. So trying to get you straight with the world.
Right.
So there's just different flavors within that as well.
I see.
But yeah, we need the x-rays to see how to adjust the patient.
Yeah.
And to make sure it's safe.
Yeah.
And what other uniquenesses we're seeing down the spine with, a reverse cervical curve or something like that. Because a lot of times those are compensations for their head not being on straight at the very top.
Right.
And to take a x-ray later in their care and see that change, a curve come back with never touching anything below C2 is like, whoa,
wow.
Okay.
That's
there's
amazing.
Some proof.
So you've seen that before?
Yes. Yeah.
Wow.
It definitely is more trends with 25-year-olds and under,
right?
As far as a faster change, of course, with many things,
right?
But yeah, it's a testament to how crucial and sensitive your body wants your top of your spine to be. And if it can't do that, it starts to compensate. And then all that compensations over years and years leads to the dysfunction and the symptoms people are coming in with.
So are there, thank you for explaining that.
Sure.
And I'm learning a lot too. There's always so much to learn within our field. Would you say that there are certain types of symptoms, conditions, like if someone's listening to this and they're like, well, I've gone to a, normal clinic where they've adjusted my neck hands-on, or I've gone to my MD and PT and this, and no one can figure out my headaches. No one can figure out,
like you said. So,
are there certain
headaches, vertigo, chronic fatigue?
Okay. Those are the big,
those are what most people come in with. I'd say 50% of my patients are migraines.
Okay.
And then there's variations of what frequency of those migraines.
Sure.
Some people have them every other day. Some people have a migraine for 15 days in a row. And I'm like, how are these people
surviving?
Living? And those are where the miracle stories come in. It's like, oh, wow, you don't have to be in a dark room for multiple days. Trying not to vomit.
Shut
things.
down.
You can be out and socialize and interact with your family.
Right.
So that's where it really comes into, you get your passion when you see those changes in someone's life. But it's usually migraines, chronic headaches, vertigo, chronic fatigue. And then neck pain itself isn't always the chief complaint someone's showing up with.
Right.
Because the upper cervical misalignment can be kind of a dormant, silent situation. Where the soft tissue may have healed around the injury, but the slight misalignment with the dropped nerve signals over many years adds up, and then they spill over into I'm 45 years old, female with migraines out of nowhere. Something like that. So
that's kind of reminds me of, and your name came up when I had Dr. Mystery. TMJ doc. She's a dentist up in Vancouver, Washington, and she was talking about symptoms that people don't put it together that it's coming from their jaw. It might be like an earache or tinnitus, like ringing in the ear, and they're like, what? That's my jaw. But she was saying that, I like working with upper cervical doctors because sometimes that C1-2 alignment can really influence their jaw pain. And
it's all real close related. Structurally and neurologically, there's some intertwined connections there that if someone has bruxism or they're talking about my jaw pops when I open it up, when we're going through the history, I'm like, maybe we should have you see a TMJ doctor. Specific. Because not all dentists do that stuff. But it's also other ways maybe they come to me is they did TMJ care, which was appropriate and done well, but it didn't completely resolve stuff because their upper neck wasn't in alignment. And so most patients will come to me by doing multiple things and getting some improvement. But it harmonizes it all, or it makes it more efficient if they continue.
Yeah.
So it's a lot of TMJ is a gnarly one.
Yeah.
And if you are ever experienced where your mouth can't even shut or can't open, like, oh no, what are you going to do? Your jaw's locked or just the constant clicking. You got to eat, have a straw for the rest of your life.
Yeah. So can you think of, for our listeners, a story or two of a patient that came in that, was like, I've gone to this place, that place, really took their life over, and like what they experienced after?
A common one is as vertigo, or maybe not even diagnosed as that, is just some sort of imbalance feeling where a patient, and is a common story, but I can think of one where she would have these episodes that would be so random that it would of dizziness. That she'd just go through her day, be at work or in the beginning of her day, and it would hit her where it would just be so dizzy and imbalanced. She'd drop to the floor and almost start barfing.
Wow.
Sorry. Yeah. So who could live your life like that? Like, you can't hold down a job.
Yeah.
That's what happened. She lost her job because they gave her so much leeway, but then they're like, you got to go on disability or something.
Right.
So she, does what everyone tries to do, primary care.
Yeah.
And they sent her to ENT.
Yeah.
And they run all the tests. And they say, it's not your inner ear.
Yeah.
You don't have a tumor, up in there. And they're like, we don't know what to do. Here's some medication when it happens. So somehow, either on TikTok or something, Upper Cervical out there, she looked me up and we started some care.
Okay.
This type of care isn't like a light switch. So when you get your adjustment, you don't necessarily feel amazing right then.
Right.
Some people do.
Yeah.
But what I like to describe it as, it's like a dimmer switch.
Okay.
As we get you back online with your brain stem getting signals through, that adds up to the good feeling.
Okay.
And the other part too is health and healing. There's some factor of time in there.
Yeah, for
Even
sure.
if you get a surgery and you change something structurally, you got a recovery period after.
Totally.
So I like to tell patients, as I'm getting you in alignment and your body is holding that, that's going to be long-term healing. And so that's what this patient experienced is, they might be dizzy, but not quite as intense.
Okay.
And then the frequency of the episodes started going down. And then by the time, maybe around 6 months, they were like, I need to go work again. They felt confident to do that they weren't worried about drop attacks of dizziness, and then started dating. Then, just their whole life came back.
That's awesome.
And it wasn't me, it was their body trying to get those nerve signals through. Yeah. And it was just stuck. And no one had checked that specific area.
Right.
And so that's kind of where my job gets.
I mean, that's life changing.
Yeah. Yeah. That's what keeps me like, hey, were we going to get one of those patients today?
Yeah. That's awesome.
But also all my routine patients that get their wellness checkup, I love seeing them anyway,
Yeah, for sure.
So, but some of those ones are like, oh yeah, we got to get them back in there on video testimonial or something.
No kidding.
Because it is, I mean, some will do a review. And so they're out there, Google review that they write many paragraphs on what happened and how their life's different.
Yeah. I mean, talking to a lot of upper cervical doctors, like that's where I hear probably the biggest miracle stories.
Yeah. Yes.
And it makes sense. Your brainstem's there. And I
yeah,
remember in school, there's a lot of studies too on like lowering blood pressure by 10 points. And like, wow, there's definitely something here.
Yes.
Yeah.
The neurology is highly innervated in that area,
right,
which is why it makes it so effective for certain people who have that issue.
Yeah.
If someone has like a low back disc herniation and their option is maybe surgery, but they haven't tried general chiropractic or I'm like, I don't think I'm the best fit for that.
Okay.
Even though posturally, and maybe some upper cervical doctors like, yeah, I'll take that on.
Yeah.
For me, I'm like, well, maybe a more focused approach on that low back would be great.
Yeah.
But it's not someone that is complaining of chronic headaches or something else.
Yeah.
So there is, I see myself as a piece of the health pie.
Okay. Yeah, for sure.
Everyone needs, of course, your pillars of health, like good diet, exercise,
for sure,
mental health, something else probably in there. And then the foundation I see is, okay, your nervous system.
Mm-hmm.
And if it's interacting with the upper cervical because of some trauma in the past,
Mm-hmm.
that's where I can really shine.
Yeah.
Other parts might be functional neurology.
Yeah.
Maybe an idea for another podcast.
Yeah, for sure.
And also it might be, the full spine needs some work,
Right.
multiple injuries,
Right.
things solidify. All those nerve roots are trying to talk to your body and get information up and down. So yeah, there's kind of an area I fit.
Yeah.
And I like being in there.
Yeah.
And not necessarily like I can help everyone with everything.
Sure.
Maybe it can, but I wouldn't say.
Yeah.
But I also, some people like to say, well, if you did that, you must be a healer. I'm like, that's kind of a weird feeling for me.
I think
and that's
you are.
fine. But I really like to put the emphasis back on patients as your body, it has an innate ability
Right.
and an intelligence
Right.
to heal itself.
Yeah.
If it can communicate.
Right.
And there's no interference to the nervous system.
Yeah.
And that's kind of what we're taught as chiropractors.
Yeah.
So where I'm like, okay, where's the big boy gonna not have good communication? Is that atlas axis area where it's really fun to work in.
Yeah. No, we talk a lot about that in the clinic of like, hey, you fall down, you get a cut. I mean, do you have to go to the doctor for it to start scabbing up, healing up? Like you said, the body does have this innate ability to heal.
Yes.
And sometimes we got to shift and move and give the body some tools and a little outside influence. But if it's in the right, spot, it should heal itself.
Sure. Yes.
Yeah.
Yeah. It doesn't have to get too crazy or technical.
Right. Yeah. It's like our body's not meant to stay in pain forever, ever. I mean, there's certain conditions and things, but for what we're talking about, it's like, the body can heal itself if given the right, influence.
So there's the other similar stories with, migraine sufferers, saw the neurologist, saw the neurosurgeons, things like that, where they do end up coming to me.
Mm-hmm.
And even chiropractic care, they've had multiple years and it was good for them. But they said, there's just something else. And I was like, great, you did chiropractic already. I don't have to explain a ton.
Okay.
Let's just look at a different spot. In more specific, way. It kind of is nice because people come in and they get all the legwork done.
Mm-hmm.
They got their labs, they got some imaging.
Yeah, you ruled out a ton.
Right. So I kind of feel bad. I'm like, I'm just cherry picking here.
No, it's great. I mean, I've definitely, it's like we can't help everybody here, and we've run into cases where I'm like, I think you should go explore upper cervical.
And likewise, I refer out when I like, I just felt T5 is stuck and there's a rib below it that's just chronically doing something weird. I'm not going to be able to really be the best fit for that. Oh, Dr. Rhodes is down the road or something.
No, it's just like within, let's say, MDs, there's this kind of doctor that fixes that. Oh, hey, you need to go see this other MD for that thing. Like within chiropractic, there's different chiros that, specialize in different things. So, and us working together for the best of our patients.
Of course.
Is what we should do. That's great. That's awesome. So, I'm curious, when you do the adjustment, if someone has had, regular chiropractic, are they going to hear a pop?
Sometimes.
Like, what do they sometimes? Okay.
So it depends on,
because there's also patients that come and they're like, I just can't have anyone pop my neck. There's no way. I'm just nervous.
And you guys have techniques for that?
Kind of. Yes, but there are some where I'm like, you may want to explore upper cervical. If it really is like, I don't want the big pop. I don't want my neck twisted.
I would say maybe half of our patients are in that mindset of like, ooh, I'm scared. I don't want my neck twisted hard. Or one time they went and the chiropractor didn't tell them what was going to happen.
Didn't walk them through it.
And they got freaked out. So I tried lightly at the beginning as far as trying to really educate the patient. This is what we do. This is what you experience. Are you comfortable with that? Most are. If some aren't, then we try to even customize the adjustment a little bit more. And if not, then we figure out who else might be a good fit. So we're not trying to just put everyone into one hole.
But then they're not going to hear this huge pop.
Some do.
Some do.
And
okay.
the people that do like it.
Okay.
And I always have
we
to
call those people crack addicts.
Yes. I tell a similar joke. Don't get addicted to crack.
Right.
But
yeah.
It's not always a bad thing.
Yeah.
And it's a cavitation, right?
Right.
I believe it's the nitrogen bubble inside that synovial fluid in the joint capsule that shifts. I always try to say like a Snapple cap.
Yeah.
But no one drinks Snapple anymore.
I know. It's not trending anymore.
But no, probably half of adjustments are with maybe a drop headpiece. So there's no sound except for the headpiece coming down.
Oh, okay.
Some people are like, did you even do anything right away? And then they start feeling their body come back online. So it doesn't have to be a big, nasty, scary sound.
Many times it's not.
It can be if you really want it to be.
Yeah. Okay. Another question I had for you as we're chatting is, do you see babies?
Oh, great question.
And then also just, kids.
So earlier in practice, I was open to seeing more pediatrics.
Okay.
And then I realized there's other people that are way better at it than I am. So
got it.
I usually would say, an 8-year-old and older.
Okay.
Just because x-rays around that time, I just really wouldn't I have an 8-year-old and I don't really want to x-ray him if I really, really had to.
Yeah.
But if it's a bad case, super dysfunction happening, I feel more confident about that age and on.
Okay.
If a person's coming in, I would say age-wise, what I see is 20 to, mostly 20 to 65.
Okay.
Age range. If there's a kid in my clinic, it's because it was a parent that brought him in and saw how life-changing it was for them. And they're like, I don't want my kid going through that.
Yeah.
And then we kind of work through, is it a good fit that I can do? Mostly is the kid going to be somewhat responsive with, hey, we're going to do this. Are you okay with that? I'm going to do this. Yeah. So if it's an infant, I'm way out of my league.
Who do you refer to in this area? Do you have a good go-to for that?
I don't.
Oh, okay.
I mean, it's been
all right. Another podcast episode, maybe
pediatric.
I know there's a few great people in the area.
Yes. I mean, there's one, I think it's reminds me of the moon, Luna or Lumen or something like that.
Yeah.
But I know there's quite a few doctors that have, really deep training in it. There's still a family care practice.
Yeah, but that's their bread and butter, their niche.
Well, I took my kids to my friend, Dr. Jeff Devine. He's not in practice right now.
Okay.
But he's had multiple trainings with kids. He has his own, of course, and he's very confident. I'm not so much.
Yeah.
So
no, you got to know your limitations. I mean, I treat my own kids. We have a lot of kids in here.
Yeah.
But if it's a very challenging case, then I say, hey,
and infants and kids, 10 and under, it's super light touch if I'm going to do anything. And not many visits because they respond so fast. So it's kind of you could bring them in. I'll do a checkup. If they need an adjustment, that might be all they need. Also, because maybe they haven't been out of alignment for multiple years.
Sure.
They haven't been on this earth for a while. So
that's what I've experienced with the babies that I've worked with is 2-3 visits.
Cool.
Wow, they're improved.
Yes.
And usually it's a torticollis type issue.
But those 2 to 3 visits, you might have just saved them from getting to the chronic middle age, my body's falling apart situation. So
I agree with you. So for anyone listening that's hey, I think I might need to go see Dr. Burks. Do you take insurance? Are you a cash practice? What does that look like?
We are cash practice.
Okay.
For people who don't know what that is, that just means we don't bill the insurance.
Right.
So I like it because it's simple. For our office, you have
less
said
limitations,
you had 40 people on staff or something. You're pretty big.
20
person.
Yeah. Okay.
So we don't have a biller, but people can still use their insurance.
So anyone can come call you. I mean, they don't have to worry about in-network they can just come see you.
Yes. And if they really want to use some chiropractic benefits they might have, they can get a super receipt from us and submit that, and then the insurance will cut them a check.
Yeah.
For me, it feels more simple where there's not a third person in this weird love triangle
Yeah.
that says you have certain amount of visits.
Yep.
And then they're like, well, I only have these many. The doctor says this.
Yeah.
And there's conflict. And so we just stay out of it.
Yeah.
But we do try to help you use your insurance if
Okay.
it's available.
That's great.
Yeah.
That's great. And so if they were on their computer right now, let me look this guy up.
Sure.
They would look up the Upper Cervical Clinic, Dr.
Mhm.
Larry Burks.
Yeah.
And
uppercclinic.com. Yes.
Okay. And yeah, where exactly? I mean, I know, but for people listening,
Yeah.
like just give some big landmarks.
So we're between the Lowe's and the Home Depot
Okay.
in Tigard.
Okay.
Kind of at the top of the hill where Hunsaker is,
Mm-hmm.
or broader where I-5 meets 217. We're
Okay.
in this little triangle area there.
All right. That's
30
great.
seconds from
Yeah.
here.
You're really not that far away.
No.
Yeah. Yeah. That's awesome.
It's a good, nice area to practice.
Yeah. Oh, for sure.
You know, there's some people that are coming in from Hood River on the coast. You know, it's a central-ish area.
Yeah. I don't imagine there's a lot of chiros in this area that do exactly what you do.
There's getting to be more, which is great.
Yeah.
But not the technique I do.
Yeah.
And of course, everyone has a different personality and flavor and flair
Sure.
to
Yeah, they have
who,
to.
you know, aligns. But there's definitely a few, and that we've all kind of known each other from the start, where we're coming from the same school even.
Yeah. That's awesome.
But yeah, it's like 5% of chiropractors in the nation do upper cervical care.
Yeah.
So it's very small.
Sure.
But you know, it doesn't need to be, I
Yeah.
guess, you know?
Yeah.
So yeah.
That's awesome. Well, anything that maybe we didn't cover that you feel like is critical for people to know, or any, you know, last thoughts?
Just, you know, so for me, I'm a visual person. So I like looking at the anatomy and the structure and stuff and like, okay, you know, upper cervical, whoa, it's a whole different shape of bone. Vertebra, there's no interlocking joints.
Yeah.
The neurology is highly influenced. It's just a whole different animal. And to maybe see if you've tried many things and maybe you've got a little bit more, but you have this intuition like, I'm not back to myself.
Yeah.
Having your C1 or C2 checked out could be life-changing.
Yeah.
And I say it's not for everyone. Like we get maybe out of 70 exams, maybe one of those people, they're in perfect alignment.
Yeah.
So it's not for everyone.
Sure.
But when people come in and they've tried many things, sometimes they say, wow, I wish I would have started here.
Right.
So I guess if they're listening and they're kind of feeling like, you know, I'm okay, but that could be better, or I really haven't found a result.
Yeah.
It could be your upper neck and brainstem dysfunction.
And I mean, you would know on that first visit, yes or no, we can help you.
Yeah.
Yeah.
One of your questions before, I think we had talked, is we do our exam and then we always leave time for that first correction on the same day.
Right there. Yeah.
Yeah. Some practices do the exam and then come back for a report and start care then.
Yeah.
Some people come in from 4 hours away from us, or not, you know, some distance, and we like to make sure we carve out the time to try to do that if appropriate.
Yeah, that's awesome.
But yeah, it's usually migraines, vertigo, chronic fatigue, something around there, brain fog, or they know it, they just feel it, they put it right there, and they said ever since this car accident 15 years ago, it's right there.
Yeah,
you know? Those would be great. Potential candidates.
Right.
So
no, that's awesome. Yeah. So yeah, if you're listening right now and thinking, man, I need to go see Dr. Burks, you have the information, or you can comment on these posts or just reach out to our clinic. We can give you his information as well. So
cool.
But Dr. Larry Burks, thank you for coming on the
Dr.
podcast today.
Yeah.
Yeah. I learned a lot too. That's one other side benefit of having the podcast. I'm learning as well, you know, so it's been great. It's good to, you know, create this connection even further. So
me.
Yeah, absolutely.
I've only done like a radio show once, and that was kind of weird. This is very comfortable. So
awesome.
I mean, any of your guests in the future will be happy to just come here and chat with you.
I mean, that's why I want it to feel. It's just, if me and you are out having dinner, we're just chatting. It's more of a conversational style that anyone can understand.
Very inviting and comfortable. Appreciate
awesome.
it.
All right. Well, thanks, Doc. Back to helping patients, right?
Sounds good. Yep. Back to work.
All right.